Hi friends, welcome. Today we are going to learn the pericardium. Pericardium is a fibroserous sac which covers the heart and great vessels. It's a fibroserous sac which covers the heart and great vessels. Okay, and it is in the middle mediastinum. So here in this section, you are seeing the mediastinum. So here we have the thoracoabdominal diaphragm. Here by the right and left lungs, and here is the heart along with the pericardium. Okay, so here in this diagram again you are seeing the heart and great vessels along with the pericardium in the middle mediastinum. The pericardium is a double layered structure. It has got two layers. There is an outer fibrous layer and inner serous layer. Outer fibrous layer and inner serous layer. Now let us see the features of fibrous pericardium. And the fibrous pericardium is a very strong fibrous single layered sac. It is single layered. So here is the fibrous pericardium and here we have the serous pericardium. The fibrous pericardium is a single layered sac which encloses the heart, the whole of the heart, and the root of great vessels. We have the heart over here. Here we have the great vessels. Okay, so it covers the heart and the root of great vessels. It is. And what are the features of this fibrous pericardium? The fibrous pericardium is conical in shape. We have conical in shape. Here is apex and this is the base. The base of the fibrous pericardium is blends with the central tendon of diaphragm, and at the apex this fibrous pericardium blends with the great vessels. We have the aorta, superior vena cava, pulmonary trunk, all these vessels you can see here, and the apex, this fibrous pericardium is blends with the root of great vessels. Okay, and anteriorly we have this anterior surface of the pericardium, which is related to the anterior mediastinum, where we have the superior and inferior sternopericardial ligaments. Then posteriorly it is related to the principal bronchus. Then we have the esophagus and descending thoracic aorta. The posteriorly is related to the principal bronchus. Then we have the descending thoracic aorta. Then we have the esophagus. These are the structures related to anterior and posterior to the pericardium. Then on either side we have phrenic nerves. Phrenic nerves. Now let us see the serous pericardium. Serous pericardium, it's a double layered structure and it has got two layers. Okay, outer parietal layer. Here we have an outer parietal layer and an inner visceral layer. So this is the parietal layer, and here inner part we have the visceral layer. This is the visceral layer. In between the outer and inner layer of the serous pericardium, there is a pericardial cavity. Now this parietal pericardium is sensitive to pain sensitive, whereas this visceral layer is pain insensitive. Remember these 2 points. Now let us learn the sinuses of pericardium. What do you mean by sinuses of pericardium? There are sinuses means spaces. There are two sinuses of pericardium. There is an oblique sinus and transverse sinus. First let us learn the transverse sinus of pericardium. Okay, where you can see the transverse sinus of pericardium. Okay, and how these sinus of pericardium are formed? These sinus of pericardium are formed by reflection of visceral layer of serous pericardium around the great vessels. The superior border of the heart is known as the clinical base of heart. Okay, so if you see this superior border, we have what are the structures present. Okay, we have the superior vena cava, then we have the inferior vena cava, then we have the pulmonary veins, then there is a pulmonary trunk, and we have the aorta. So here we have these veins, superior vena cava, inferior vena cava, and the pulmonary vein, and we have the pulmonary trunk and aorta. Okay, so the part where these structures situated is known as a venous tube. We just call them as a venous tube, and these structures constitute the arterial tube. Okay, and this sinus of pericardium, it is present between the arterial tube and venous tube. You know, the arterial tube encloses the ascending aorta and pulmonary trunk, whereas the venous tube encloses superior vena cava, inferior vena cava, and 4 pulmonary veins. Now, what do you mean by transverse sinus of pericardium? So just look at this diagram. We are seeing the posterior aspect of the heart. Okay, so here what are the structures? Let us see the structures here. We have the ascending aorta here, then we have the pulmonary trunk, then here we have the superior vena cava, then we have 4 pulmonary veins, and here we have inferior vena cava. Okay, so the space, the sinus between the arterial tube, that is ascending aorta, and the pulmonary trunk, form the rest all forms a venous tube. There is a transverse space between these two, arterial tube and venous tube. So that sinus is known as a transverse sinus. Let us see the boundary. So transverse sinus lies behind the ascending aorta and pulmonary trunk, and in front of superior vena cava and the superior pulmonary veins. So this space is known as the transverse sinus of pericardium. Now let us see oblique sinus. We are seeing the posterior aspect of the heart. So here we have the 4 pulmonary veins are there. We have inferior vena cava. Reflection of this particular pericardium over these 4 pulmonary veins makes a cavity. Okay, so that cavity is an example of cul-de-sac. Cul-de-sac means a pocket. Suppose, see, this is somewhat like this. So here we have 2 pulmonary veins on the left side, right pulmonary veins are there. Okay, and the pericardium which is reflected over this one, and it makes a cavity like this, one-sided open cavity, that is known as a cul-de-sac, and this space is known as the oblique sinus. Okay, where you can see oblique sinus is present just behind the left atrium. It is present just behind the left atrium. Okay, and what is the importance of this oblique sinus? Oblique sinus gives a space, it is a potential space, it gives a space for the expansion of left atrium. Let us see the boundaries of this oblique sinus. Okay, you know, I told you it is present just behind the left atrium. So anteriorly we have the left atrium, posteriorly we have the parietal pericardium. On the right side, what structure we can see? The reflection of the pericardium on the right pulmonary veins. On the left side, we have the reflection of pericardium on the left pulmonary veins. Superiorly, you can see the reflection of the visceral pericardium along the right and left superior pulmonary veins, and inferiorly it is open. Okay. Now the blood supply of pericardium. You know, the pericardium is supplied by internal thoracic artery, musculophrenic artery, and descending thoracic aorta. Now coming to the nerve supply. The fibrous pericardium and the parietal layer of the serous pericardium is supplied by the phrenic nerve. Remember, phrenic nerve, and this layer is pain sensitive. Whereas the serous pericardium supplied by the autonomic nerves, so it is pain insensitive. What do you mean by pericardial effusion or cardiac tamponade? It is nothing but the inflammation of the serous pericardium. Inflammation of serous pericardium. Okay, you know, Here just I am drawing the pericardium. Inside we have the heart. Okay, we have the pericardial cavity. Okay, so if there is an inflammation, if this pericardial cavity filled with the fluid, that condition is known as a pericardial effusion. Pericardial effusion. The excessive accumulation of the serous fluid in the pericardial cavity may compresses the thin walled area. So what happens if this area filled with excess fluid? It compresses the atria. Atria are thin walled. Okay, it compresses the thin walled atria, and atria are the chambers which receives blood. When this atria get compressed, it compromises the filling of the heart during diastole, and if there is no limited filling, the cardiac output will be affected. This condition is known as the cardiac tamponade. Cardiac tamponade. Pericardial effusion, it is the excess fluid in the pericardial cavity. Okay, so it leads to cardiac tamponade. So the excessive pericardial fluid has to be removed. Okay, so that procedure is known as the pericardiocentesis. Pericardiocentesis is the excessive pericardial fluid removal. It is done by two routes. There is a sternal approach. So in this sternal approach, the needle is inserted through the left fifth intercostal space. Needle introduced to the left fifth intercostal space in the sternal approach. And next is known as the subxiphoid approach. Subxiphoid approach. Okay, so here in this subxiphoid approach, the needle is inserted in the left costoxiphoid angle. Left costoxiphoid angle. What is the surgical importance of the transverse pericardial sinus? Just look at the picture. So here the finger is in the transverse sinus of pericardium. What is important? During cardiac surgery, after the pericardial sac is opened anteriorly, a finger is passed through the transverse sinus of pericardium, posterior to the arch of aorta and the pulmonary trunk. Okay, a temporary ligature is passed through the transverse sinus around the aorta and pulmonary trunk. The tubes of heart-lung machine is inserted into these vessels and the ligation is tightened.